Hey guys, here I am again with another video. Before heading towards the video, please like, share and subscribe Netflix if you have not done yet. Today we will cover A to Z important terminologies of OBGYN. So let's start. Antenatal, before the birth, amniotic fluid, sometimes called liquor. This is the fluid that surrounds the baby in the uterus. Amniotic sac, the bag in which the fetus and amniotic fluid are contained during pregnancy. Albumin, this is a protein. If it's present in your urine, it may be a sign of preeclampsia or an infection such as cystitis. Alpha fetoprotein, a substance present in the blood of pregnant women. This is tested as a part of Down syndrome screening test. Cephalic, this means the baby is lying with its head in the lower part of the uterus. Chorionic villus sampling, a prenatal test that scans for genetic abnormalities. It is a diagnostic test. Congenital, present at birth. Crowning, the point in labor when the head of the baby can be seen at the vagina. Diamorphin, this is an injection given for pain relief in the labor. Dilatation, in the first stage of labor, the cervix or the neck of the womb gradually opens up to make the space for the baby. Eclampsia, a serious complication of pregnancy characterized by high blood pressure and edema that can result in a seizure, fits. Ectopic pregnancy, a pregnancy that develops somewhere other than the uterus, usually in the fallopian tube. Expected date of delivery, the date when your baby is due. Antonox, a mixture of oxygen and nitrous oxide inhaled through a mask or mouthpiece by the mother during labor for pain relief. Episiotomy, a cut made in the mother's perineum, the area between the vagina and anus, to allow the baby to be born more quickly and prevent tearing. Fetus, medical name for the baby before it's born. Fontanelles, the two soft spots on the newborn's head where the skull bones do not yet meet. Anterior fontanelle and posterior fontanelle. Fundus, this is the top of the uterus. The fundal height helps assess the growth of the baby and how many weeks pregnant you are. Gestational age, how far into the pregnancy you are, measured from the first day of your last menstrual period. Hemorrhage, sudden and severe bleeding. In pregnancy it is called as antepartum hemorrhage, and after the birth it is called as postpartum hemorrhage. Induction is starting the labor artificially. Lithotomy position, a position used for the assisted deliveries where the mother lies flat on her back with her legs raised and apart, supported by stirrups. Look here, for a couple of weeks or more after the birth, the woman loses a mixture of blood and mucus through the vagina. Meconium, the bowel contents of the baby at birth. Multigravida, a woman who has been pregnant before. Multipara, woman who has given birth at least once before. NAD, nothing abnormal detected. The doctor or midwife may write this on your notes when they find no problems. Neonate, a newborn infant. Oxytocin, the hormone secreted by women when they are in labor, which stimulates labor contractions. Perineum, the area of skin between your vagina and anus. Pessary, a special type of medication designed to be inserted into vagina. Prostaglandin pessaries are sometimes used to induce labor. Placenta, the organ that develops in the uterus during pregnancy to transfer nourishment and oxygen to the baby from mother's system and to take away the baby's waste matter. Placental abruption, premature separation of the placenta from the uterine wall. Placenta previa, When the placenta is low down, sometimes it covers the cervix and blocks the baby's exit, in which case you would need a cesarean section. Polyhydramnios, an excessive amount of amniotic fluid. Postpartum, relating to the period of few days after the birth. Preeclampsia, this is a complication of pregnancy where the blood pressure increases and protein appears in the urine. Primipara, a woman giving birth for the first time. Prostaglandin, a natural substance used in the pessaries to soften the cervix and stimulate the start of labor. Show is when the thick mucus which plugs the narrow channel of the cervix during pregnancy comes away. It is a sign that the body is getting ready for the labor. Transcutaneous electrical nerve stimulation, a device for relieving the pain of the labor. Sticky pads are attached to the woman's back to produce electrical impulses which stimulates her own natural painkillers and blocks some of the pain signals from the uterus. Ventouse, this is a name given to the method of vacuum extraction to help the baby be born at the end of labor. Vernix, a white waxy substance that covers the fetus in the uterus. That's all for today. If you like my video, kindly like, share and subscribe to Maths Bliss. Thank you.